Environmental neurotoxins and neurodevelopmental disorders among children. The tiniest changes in the complex sequence of events needed during the 9 months before, such as a momentary disruption of brain development caused by low-level exposure to lead, a pesticide or an endocrine-disrupting chemical, can interfere with the normal developmental processes and cause serious damage to newborn babies. Therefore, preventing exposure during pregnancy and in early childhood to chemicals that can damage the central nervous system is extremely important. There are several chemicals known to be linked to neurodevelopmental disorders in children. These chemicals can cause learning disabilities, sensory deficits, developmental delays, autism, and attention deficit/hyperactivity disorder. Exposures to these chemicals prenatally and in early childhood are the most dangerous. These environmental neurotoxins include arsenic and manganese. Prenatal exposures to the metals arsenic and manganese are linked to neurodevelopmental impairment and reduced IQ in children. Manganese from industrial emissions or from some manganese-containing fungicides can harm a child's developing brain. Bisphenol A, a synthetic chemical used to manufacture polycarbonate plastic, is linked to a plethora of behavioral abnormalities. Brominated flame retardants. Prenatal exposure to brominated flame retardants has been linked to cognitive impairment, with lowered IQ and behavioral abnormalities. Lead causes brain damage in children. From the discovery in the early 20th century of lead poisoning in Australian children, to the removal of tetrethyl lead from petrol in the 1970s, to the epidemic of lead poisoning in Flint, Michigan in the United States in 2014, lead is now the best understood of all neurodevelopmental toxins. But the problem is still not solved. We have always to remember that no level of lead is safe. The Institute for Health Metrics and Evaluation, IHME, estimated that in 2017, lead exposure accounted for 1.06 million deaths and 24.4 million years of healthy life lost as a result of disability worldwide due to long-term effects on health. IHME also estimated that in 2016, lead exposure accounted for 63.2% of the global burden of idiopathic developmental intellectual disability, 10.3% of the global burden of hypertensive heart disease, 5.6% of the global burden of the ischemic heart disease and 6.2% of the global burden of stroke. Those children who are exposed to lead poisoning, and many generations of children before them, have or will suffer the effects of lead poisoning. Children of mothers who had lead poisoning in childhood are more likely to suffer neurodevelopmental disorders than children of unaffected mothers. Jails and prisons worldwide hold a high proportion of adults who had lead poisoning as children. The neurobehavioral effects of lead poisoning are much better understood than are the results of exposure to other unknown chemicals in the environment. But lead-related damage will continue as long as there is lead in the paint and the plumbing of older houses, waiting to poison another child who moves in. Mercury is another well-studied toxic metal. Metallic mercury is toxic and vaporizes easily. Another form of mercury, methyl mercury, is found in many contaminated lakes and streams due to the release of mercury-containing waste from factories and industries. Fish from these bodies of water cannot be eaten. The methyl mercury accumulates up the food chain as larger fish eat contaminated smaller fish who have eaten contaminated algae, and so on, and levels of methyl mercury can reach extremely high levels in the predator fish at the top of the food chain. In the ocean, a similar course of events occurs as larger fish, such as swordfish, shark, king mackerel, and tilefish, may accumulate high levels of methyl mercury and can pose a danger to the developing infant of a pregnant woman who eats the fish. Medical professionals always warn of unsafe fish or suggest limits of the amount of fish that should be eaten by a pregnant woman. The most severe form of methyl mercury poisoning was seen in Minamoto, Japan, in 1956, where pregnant women who ate contaminated fish gave birth to severely neurologically damaged children. Polychlorinated biphenyls, PCBs. PCBs are a family of synthetic chemical compounds that contain chlorine. They are clear, oily, non-flammable liquids that resist heat and do not conduct electricity. They were widely used until the 1970s as liquid insulators in transformers, capacitors, and fluorescent light ballasts. The PCBs that have been released into the environment have washed into our harbors, lakes, and rivers and settled to the bottom, where they persist in the sediment. Although PCBs are no longer manufactured, they were used extensively for many years, and they continue to be important contaminants because they are persistent in the environment. PCBs do not break down, and they resist microbes that naturally destroy most chemical compounds, so they last in the environment for decades and maybe centuries. PCBs are soluble in fatty tissues, where they accumulate and move up the food chain. Like methyl mercury, PCBs accumulate to high levels in certain species of fish. From the sediments at the bottom of the lakes and rivers they are taken up by worms, shellfish, catfish, and other bottom-feeding fish, including eels. When the bottom dwellers are eaten by game fish, the PCBs accumulate to even higher levels in the fatty tissues of the predator species. Finally, when top predators such as eagles, ospreys, bears, or humans eat fish, they accumulate high levels of PCBs. Human prenatal exposure to PCBs is principally the consequence of maternal consumption of contaminated fish before and during pregnancy. Prenatal exposure to PCBs is linked to reduction in children's intelligence. Pesticides. Prenatal exposure to the organophosphate insecticide chlorpyrifos is associated with reduced head circumference at birth, which is a well-known indicator of delayed brain development during pregnancy, and future developmental delays. Prenatal chlorpyrifos exposures are also associated with cognitive impairments detectable at age 8 to 9 years, and with increased risk of autism spectrum disorder. DDT exposure has been linked to increased risk of breast cancer in women who were exposed in early life. There is also a higher incidence of breast cancer in women whose mothers were exposed to DDT while they were pregnant with them. Phthalates. Baby boys prenatally exposed to phthalates, a widely used class of chemicals found in plastics, cosmetics, and many common household products, appear to be at increased risk of behavioral abnormalities that resemble attention deficit/hyperactivity disorder, ADHD. Perfluorinated chemicals, PFOA and PFOS. Prenatal exposures to the perfluorinated chemicals, PFOA and PFOS, have been linked to decreased birth weight, reduced head circumference and severe anatomical malformations in newborn infants. These chemicals are often used in non-stick cookware, firefighting equipment, weather-resistant fabric and clothing, and in other household applications. PFOA and PFOS can be detected now in the blood and tissues of every human being and animal across the globe. Copyright Academy House www.academy.house